And I want to welcome all of the families who are with us this evening, especially welcome Dr. Ramsey from our Hoag Medical Group and the newest clinic down in San Clemente. Tonight, we will be hearing from Dr. Ramsey about wellness tips and how to stay healthy during the holidays. You are welcome, if you have questions, to put them in the Q&A. The chat is closed, but the Q&A is open. And I will be monitoring that and helping to answer the questions either in the actual Q&A, or we will hold some of them over for Dr. Ramsey when she is done with her presentation. I also want to introduce Superintendent Vital Brulte. She does have a new name, but it's the same superintendent who is with us this evening. She will introduce Dr. Ramsey and say a few words. Superintendent?
Great. Good evening and welcome to our virtual town hall. I'm Kirsten Vital Brulte, your superintendent. Capistrano Unified and Hoag Medical Group are proud to present this webinar on wellness tips and how to stay healthy during the holidays. A difficult task during any busy holiday season, but especially challenging right now. So today we have the pleasure of speaking with Dr. Kayla Ramsey of Hoag Medical Group's new San Clemente office. Dr. Ramsey will be sharing with us several lifestyle changes backed by research that can help both adults and children stay healthy and help prevent health issues later in life. She will also talk about COVID-19 precautions, the effects of the pandemic on children, and much, much more. And after the presentation, Dr. Ramsey will answer any questions you may have. So without further ado, I'll turn this over to Dr. Ramsey. Welcome.
Thank you. Yeah, thank you for such a warm welcome and a great summary of what we're kind of going to be going over today. I like to champion preventative health, and I think some of the first steps that we can do is just talking about our diet, our exercise, and even our sleep, which I think goes a little unnoticed. And then, like your superintendent mentioned, this year is particularly difficult, especially with COVID. So hopefully we can cover a couple guidelines, a little bit about the vaccine, and I'm happy to answer questions. Presentation shouldn't be too long, so hopefully we'll have a lot of time. And I'm excited so many people are tuned in for the topic. So I guess let's get started. Okay, there we go. I'm a little new to Zoom presentations. I've done them in person. So our healthy food options. There's a couple different studies, guidelines, specifically by the American College of Cardiology and the American Health Association. They've recommended ways in which we can improve our diet. Specifically, they looked at factors that can reduce cardiovascular disease, decrease the incidence of certain types of cancers, and treat obesity, prevent type 2 diabetes. A couple of the most studied diets are the Mediterranean and DASH diets. The Mediterranean diet is kind of a well-rounded diet, has some restrictions. The DASH diet is a good diet, but it is kind of focusing more for hypertension and decreasing those type of side effects. So the Mediterranean DASH diets have some overlap, but slight differences as well. But some of the combination, the overlap, they both focus on decreasing red meats and certain processed foods, specifically with refined grains. And they also focus on increasing fruits, vegetables, and plant-based fats and proteins. So proteins are okay, but it just focuses a little bit more on, beans, grains, and nuts. And then because I'm a visual person, we're going to take a look at a couple tables. They also recommend how to organize your plate. And now this isn't a lot of new information, but I think it's always good to make sure we have a good understanding of the basics. So when you look at the Mediterranean and DASH diets, they recommend forming your plate similarly to what it has here. So starting off the plate with about half, if you think of the plate as a circle or a square, we get into fractions a little bit here, but half of the plate with fruits and vegetables. And then you can do about a fourth of the plate with whole grains, and then another fourth of the plate with those plant-based proteins and some animal proteins. Obviously, we want to make sure water is our primary beverage. snacks throughout the day, nuts are a good example. Too much can be, cause a lot of calories, increase fats, but in moderation, nuts are a great snack. And then oils and fats are okay in moderation as well. And then also all diets, but DASH diet specifically focuses on limiting the amount of salt. And salt, we don't think of being naturally in a lot of our foods, but they are. So a lot of the processed foods, a lot of the frozen foods. So we get almost all of our daily recommended salt intake just from these items. And that intake number is about 2,500 milligrams per day. So we say to ourselves, hey, we're not adding a lot of salt to our meals, but we're actually intaking it in a lot of different ways. So by trying to limit the amount of salt you're adding to your food could be that part that you're pushing over into the exceeded amount of salt. And then here's a nice picture. We've all seen food pyramids before, but this one is specific for the Mediterranean diet. So we see at the very bottom, we want our focus to be on exercise. And then we go into the grains, the vegetables, olive oil, herbs and spices, and we can eat these with all meals. Then in that next little bracket, we have some of the animal-based proteins. The ones that are the healthiest are seafoods, fish, shellfish, and then we go into the next tier, which is poultry, eggs, and dairy. These can definitely be okay in moderation. And then right there at the top, that's what we want to limit the most. So the red meats and the sweets. Doesn't mean we can't have them, but just in moderation. Again, its focus is here on having water a day, and our water as our main beverage throughout the day. And actually it allows for wine in some moderation. And I kind of listed here, this diet can be good for kids as well. But as it mentions, there are nuts and milk associated with this diet. And we don't start introducing milk for kids until 1 year old. And then we don't do low fat milks until 2 and greater. And then for whole nuts, just because they can be a choking hazard, recommendation is typically above 4 years old. And now we move on to how can we try to do our best around the holidays when there's so much good food, but sometimes not the best for us. So some of the recommendations I have are trying not to skip meals, because if we all do it, but we try to not eat as much throughout the day, but actually we'll be even more hungry and likely to overeat when that big meal comes. If you have a big sweet tooth like I do, it doesn't mean you can't have it, but maybe try to cut back on other types of foods, like specifically like carbs, the potatoes, the breads during the actual meal. And then I kind of again listed here, when we have more of that buffet style, we get really excited about all our favorite foods that we don't necessarily get throughout the year. But maybe start filling your plate with some of the healthy options, but specifically watch out for some of those vegetable options that have lots of butter, sauce, and cheese. And then if you want to have a small plate of the foods you like best, like I mentioned earlier, maybe the things that you don't necessarily eat throughout the year, don't necessarily feel guilty on having those. But if you indulge a little bit too much, maybe you had a couple too many slices of pie, it doesn't mean you completely fell off the wagon. You can get right back to your healthy eating with your next meal. And actually one of the most important things is eat slowly. It actually takes your body about 20 minutes for you to realize you're full. So sometimes, again, we get very excited. This is delicious food. We eat it a little quickly, and then we keep making ourselves a little too full. All right. And then how do we counteract if we overeat a little bit too much? With exercise. So again, the same governing bodies that did some of that research for the Mediterranean and DASH diets did research on how much exercise is actually healthy for our heart. So again, the American College of Cardiology and American Heart Association. And they found that exercising a minimum of 150 minutes, specifically moderate intensity, and or 75 minutes of vigorous activity per week reduces our cardiovascular risk. So this is heart attack, stroke, and associated medical conditions that can lead to heart attack and stroke. It improves our glycemic control and also helps with weight loss. And then slightly different, but related to exercise, research also showed that strength and resistance training can increase bone mass and reduce age-related fractures due to osteoporosis. And again, because I'm visual, let's look at this a little bit more in a picture. And if you're saying, what is moderate, vigorous, intensity type exercise? What are you talking about when you're talking about strength resistance training? These are some examples. So a lot of these things we're already doing. So moderate intensity is, brisk walking. Some of us like water aerobics. A lot of us have bought Pelotons during the last couple of months. Riding a bike is considered at moderate intensity. Doubles tennis, even pushing a lawnmower. Some of those lawnmowers are pretty heavy. Vigorous intensity exercise includes running, jogging, swimming laps rather than just the water aerobics. Riding a bike, at a faster pace or even up a hill is more vigorous. And then singles tennis, because you're running around the court a little bit more, as well as basketball. And then strength and resistance training, you want to be using either weights, resistance bands, or your own body weight. So things like yoga, push-ups, sit-ups, and then some of us, do things around the house that are considered strength and resistance training. So things like gardening, more or less with that more excessive digging. And then specifically I have here in this pictorial, how much exercise is actually good for kids. Kids and teens should actually get about 60 minutes of physical activity every day. But obviously a lot of these activities are good for kids as well. And how am I going to fit this 150 minutes or 75 minutes of moderate, vigorous activity into my day? So they're not talking about doing this all at once. They found that even if you split this up throughout the day, throughout the week, it's just as effective. So that 150 minutes can split up about 30 minutes a day, 5 times a week. And if you're thinking to yourself, I don't have that 30 minutes, and that's reasonable, you can even split that 30 minutes even into 10 minutes. So maybe 10 minutes in the morning, lunch, afternoon. And then if you're already really good and you're doing a more vigorous activity, you're probably meeting some of that criteria. So it's 150 minutes of moderate or 75 minutes of vigorous. And you could also do a combination of the two, but the 75 minutes can be spaced out as well. And then if you're trying to get even more added benefits, adding that high intensity muscle strengthening activities can increase your bone mass, lower your blood pressure and your cholesterol. And now we're kind of move on to sleep. So sleep is increasingly being recognized as a good component of health. So the American Academy of Sleep Medicine suggests a minimum of 7 hours of sleep a night for adults. It's not only important to get good quantity of sleep, meaning how many hours, but also good quality. Ongoing sleep deficiency is linked to increased risk of cardiovascular disease, stress, weight gain, and poor memory. And I have here, if you suspect you have a sleep disorder that interferes with your sleep, such as sleep apnea or restless leg, you can talk to your doctor. And then when we're talking about good and I do have a slide here specifically for children. So 7 hours is good for adults, but kids need slightly different recommendations. So getting enough sleep can help prevent these things in kids: obesity, diabetes, attention and behavior problems, poor mental health, and then accidental injuries. So children from 6 to 12 years old need 9 to 12 hours of sleep a night. And then teens aged 13 to 18 years old need about 8 to 10 hours of sleep per night. And then I have this pictorial, which I was thinking was the next slide. And this is what's considered sleep hygiene. So things that we're all sometimes guilty of not doing that will help us get better restful sleep. So some of these are kind of obvious, like trying to go to bed at the same time every night, even on the weekends, trying to avoid caffeine consumption, in the later afternoons. But sometimes we're not so good at the things like keeping electronic devices out of the bedroom. So we fall asleep with the TV on, we're playing on our phones when we're falling asleep, maybe even video games. And then a lot of us have our fur friends, dogs, cats around. Sometimes they can be pretty disruptive if they're in the room at night. And that doesn't mean all of these things are bad, but if you're not getting restful sleep, you may start wanting to look at a couple of these items to see if you can improve your sleep. So this year has been stressful, but the holidays can be stressful in general. Sometimes we're staying up later than usual. Sometimes we're more sleep deprived. And then sometimes when we're sleep deprived, we eat and prefer higher fat foods, higher sugars. And then being active can actually make up for eating a little bit more. It can reduce our stress and help us, de-stress during the time of year. So trying to make sure we're, getting good sleep during this time of year and trying to exercise. All right. And kind of like I mentioned earlier, we're going to talk a little bit about COVID. So there's obviously a lot of uncertainty about the coronavirus. This has brought a lot of anxiety. And we've had to do a lot of new things this year that we never had to do before. And we often are talking about how this has been affecting adults, how it's been affecting our economy, how it's been affecting our social life, how it's affecting healthcare. But sometimes we forget how this may be affecting our kids. So they've had to change their routines too. They've had to miss a lot of significant life events. Some of our high school graduates haven't had their typical, ceremonies. They've had breaks in the continuity of healthcare. We think, oh, we're overwhelming the healthcare system, but a lot of these kids have been missing their well child visits, their immunizations. They haven't been able to have access to a lot of mental health, speech, occupational health services. And then obviously breaks in their continuity of learning. We've all had to do more virtual working from home and learning during this time. And that can have, some effect on their social, emotional, physical health. And sometimes kids don't always have the words to express their anxieties or their worries. And these are just a couple signs or symptoms that you may want to watch out for to see if your kids, are having a little bit too much stress in their life. So sometimes they're more irritable than usual. Depending on their age, they can be more confrontational. We talked about trouble sleeping. That can be a symptom of anxiety. Sometimes being distracted, they lose interest in activities, they previously enjoyed doing. They can change their eating patterns. Sometimes they are less focused, so they drop off in their academic effort. And then sometimes, maybe they have not as much interest in grooming and, physical presentation. But it's, just some reassurance around this time. Try to stick to your normal routines, which I know is hard, but hopefully we are all in this together and we can find ways to move forward. And then speaking of virtual learning, we've all had to work and learn from home. And maybe some of us have been able to adapt really well so far. But if we're still struggling or you're looking for ideas to try to, keep everybody focused when there's lots of cooks in the kitchen doing their virtual learning and virtual working from home. So trying to keep that daily schedule conducive for your kids, trying to wake up, get dressed, have breakfast around the normal times. And most importantly, decide where everyone can do their work most efficiently. So if all the kids are at the same table, maybe someone isn't as focused because there's so many distractions going on. And then having enough breaks. So young kids may not be able to focus with virtual learning as easily as maybe the older kids. So allowing for 20 minutes of class followed by 10 minutes of physical activity, a little bit of a break. Older kids may be able to focus a bit longer. Maybe they can get through their whole class, the whole subject, and then be able to take a break, maybe have some stretches, physical activity for them, maybe even snacks. And then sometimes if the kids are struggling and you're working from home, they may not know when it's okay to talk to you about it because they know you're working. So maybe letting your kids know, I take breaks during this time. It's okay to ask when it's not okay to ask, when they're having trouble. And then, trying to have dinner together as a family, be able to discuss the day, not working and learning from home isn't easy. So maybe, during that time, you can come up with a couple ideas of, how best to make any changes for the future. And then as doctors, we're typically cautioning increased electronic device use. But obviously, during this time, we've all been on electronic devices more than ever. So limits are still important. As always, technology should be used constructively, and then not being, so if you shouldn't push out, needed sleep, family connection. A lot of what we've been doing is, checking in with our friends, our family through social media, through Zooming. And during this time, it's good to kind of use the media together, see how your kids are learning, see what kind of, educational websites, apps they've been using. And, there's a lot of quality content that's been developed out there. I found Common Sense Media, for example, has a lot of good family-friendly apps and things to do together. All right, and now kind of COVID for the holidays. So California Department of Public Health issued a regional stay-at-home order that started on the 6th of December because the region had less than 15% ICU availability. It's expected to remain in effect for at least 3 weeks, depending if the ICU capacity increases, and that's being assessed regularly. So under this stay-at-home order, private gatherings are prohibited, and it's closed certain operations, continues the masking and distancing, but this hasn't modified existing state school guidelines, specifically K through 12. And so if the stay-at-home order is lifted, these are some precautions for getting together for the holidays. And I do hope those are lifted because we do have rising cases. So these guidelines are that were in place at the time of Thanksgiving. So some guidelines are, have some conversation with the guests ahead of time to set expectations for celebrating, because we've never had any holidays like this or had to distance between families. So making sure everyone's on board and comfortable, with a couple of these distancing guidelines. It is recommended to have outdoor gatherings, but depending on the weather, sometimes that's not always available. So if you do have an indoor gathering, it's recommended to have some form of circulation, whether that's opening windows or doors or placing your central air heating on more of a continuous circulation. Trying to limit the number of guests and allow 6 feet apart in between members of the different households. Obviously, we're still going to want to encourage hand washing. Soap and water is best, and for at least 20 seconds. Maybe using single-use towels when possible, but if it's not as convenient to wash our hands, hand sanitizer is a good alternative, but making sure it has at least 60% alcohol in it. Trying to clean and disinfect frequently touched surfaces and items in between use. And then trying to limit the number of people in food preparation areas, or possibly having one person cook and serve the food to decrease potential exposure in that manner. And if you're uncomfortable sharing food, having guests bring their own food or drink, and using those single-use options like plastic utensils. And now a little bit about the vaccine. So on December 11th, the U.S. Food and Drug Administration issued the first emergency use authorization for a vaccine for the prevention of COVID-19, specifically in individuals 16 years and older. The emergency use allows the Pfizer vaccine to be distributed in the US. We are expected to have the vaccine available to everyone, and specifically of all ages, but the current emergency authorization was just for 16 and above. And initially, we will have a limited supply. So I have here on the slide what the California Public Health, as well as the Orange County Health Agency, have planned for a phased rollout, because there probably will be an initial limited supply. So a lot of places are expected to get this vaccine pretty soon. So like this week, next week. So I know some counties are already distributing it. So initially they're going to be giving it to the high risk population. So specifically healthcare workers, adults who live in long-term care facilities like nursing homes. And then you can see here in the phase 2, other high risk individuals. And then eventually, depending on supply, it'll be available to everyone. I'm hoping that this goes pretty quickly. I've heard reports that scale for mass vaccination may not be available till the early spring. My hope is that the other vaccines that are currently in phase 3 clinical trials will also receive the same emergency use authorization. So we'll actually have a large supply, larger supply than we currently have. And then a little bit more on the vaccine. And this is actually specific to the Pfizer vaccine because that's currently the one that got the emergency use, the certain side effects. So what people may or may not know actually is that most of these vaccines will actually be a 2-dose series, dosed 3 weeks apart, given into the muscle, just like a flu vaccine, or any vaccine for that matter. But people experience most of their side effects after that second dose versus the first. These include pain, swelling, or redness at the injection site, some tiredness, headache, muscle and joint pain, fever, chills, nausea, feeling unwell, swollen lymph nodes. These aren't, the percentage of people that have these side effects are very similar to the people that report side effects after the other type of vaccine. So it's not, it's pretty similar to the other ones. And being a 2-dose series isn't necessarily surprising because it is a novel virus. And similarly, we do actually vaccinate children after the 6 months of age with 2 doses of flu shot 3 to 4 weeks apart. So it is kind of under the similar guidelines. And I know I talk a little fast, so I probably got through this a little bit quicker than I thought I was going to. But these are my resources. So the American Academy of Family Practice, Pediatrics, Sleep Medicine, Cardiology, the FDA, the CDC. So I really try to look into these guidelines a lot for you. So hopefully, if you have any questions, I'll be able to answer them with the most up-to-date information. So I suppose we can move on to some questions.
Thank you, doctor. And we don't have a time minimum, so it was perfect. I do have some questions. We have one actually in the Q&A right now, but it's asking specifically about teens' circadian rhythms and if they shift, if it's harder for teens to fall asleep earlier, and then therefore they need to sleep later in the morning.
That is a great question. And I don't necessarily have a perfect answer for that, but I have noticed a lot of my teenage patients, the rhythms can shift. So it seems like a lot of teens stay up later and later and will want to sleep. They fall asleep at 1 or 2 in the morning, and then they're sleeping till the afternoon because they still need that same kind of, like we discussed, children to teens need slightly varying hours of sleep. So I have noticed that, and I don't have a good answer for that as why, but yes, I have noticed that in my practice.
So I know in previous talks we have discussed the idea that blue light and screen time messes with circadian rhythm and even some hormones that help with sleep.
Correct.
Are you seeing more of those issues of sleep with teens since we have been mostly distance learning the last 9 months? Are you seeing an increase, or is there anything that you can say just from your own practice?
Yeah, I would say a lot of people are having more sleep issues this year than I've noticed in previous years. I wish I could say it's due to the virtual learning or potentially just the increased anxiety of this year. It's hard for me to say which, but I think both are definitely contributing.
Yeah, I was going to say, I'm sure part of it is stress and anxiety too. One of the other benefits of just focusing on immune health and being healthy during the holidays is not just the physical health of it, but also the benefits on mental health. Could you talk a little bit about that, especially in regards to stress or anxiety, how good sleep, good nutrition helps with those kinds of things too?
Yeah, absolutely. As we were mentioning, this year more than most, we've had more increased anxiety, and if we've never experienced changes in our mental health before, sometimes those symptoms come out and we're not able to necessarily recognize them. And I will say that trying to take ownership of your health and trying to have control over something, whereas I feel like a lot of us right now feel like there's not a lot we can control in this world. So knowing that if we, are focusing on good nutrition, we're focusing on doing exercise, we're focusing on getting good sleep, I think we're able to have some form of calmness by doing that. But also naturally, by doing these things, we are making ourselves healthier. Hopefully that was able to answer the question.
Yeah. We have another question in the Q&A. How safe is in-person learning now that we've had a dramatic increase cases in the community? And I will say, just from the perspective of schools, a few weeks ago, as we knew that other, the more strict stay-at-home measures were coming out, Dr. Galley, who I believe oversees the California Department of Public Health, had actually specifically mentioned schools and talked about the fact that they weren't seeing that as a place of transmission of the coronavirus. And it was mostly due to the fact of the very high level health and safety guidelines that school districts are following and how well they're doing at that. So we have seen that it is safe, but we also built a program for our families where they had options. So we have allowed families to choose in elementary whether they're with us for a full day or a hybrid or completely online. And then in secondary, we allowed the option for families to choose either a hybrid model where they're on campus or at home, or they're 100% online. So I don't know if you have any other comments about how safe you feel about schools at this point, but we have seen an increase in the dashboard numbers for positive cases in our school sites, but we're still less than, I think, 0.5% of the number of students and staff we have as far as positive cases.
Yeah, agreed. I think the schools have been really good at all of the precautions and the guidelines they've been following. I haven't seen recent data for the schools, but in my personal practice, I haven't seen surges specifically in schools. It does seem to be in other more higher risk populations.
And another question is, do you think COVID family spread is more common than kids spreading it amongst themselves? So is it a transmission that's happening at home or in other places?
Yeah, so I would say it is more so than the schools. I think the risk is higher at home, but that's not to say I've actually seen families where everyone's got it, but I've also seen families where just one person has got it and they all live together, but they were taking, trying to use precautions at home, trying to make sure, they're limited to one room, using one restroom. So I will say the potential for spread at home is greater, but I don't want people to be worried that if one of their family members got it, that they would inevitably get it, because I've actually seen a lot of families where not everyone has actually contracted it.
Yeah, and I would just say, just for context, that we have had open schools since the beginning of September. We do not have one case of a community transmission at this point. And the dashboard shows we have 47,000 kids and about 4,500 staff. We have approximately 50, I think, positive cases on our dashboard, which is, or it might be a little higher than that. It's about 0.22% of our total students and staff. But again, we allow parents to make that choice. If you wish to move online at any point of the school year, you can do that. We want families to feel comfortable with that. I know that a lot of families are going to be making New Year's resolutions, or a lot of individuals. I know even just for me specifically, I have been on an eggnog, what's the word, like a fast, but it's non-alcoholic, but it is a lot of eggnog since probably Thanksgiving. We were talking about juice cleanses and things like that today. So do you have any recommendations or anything that you would share just as far as any of those kinds of New Year's resolutions?
Specifically on cleanses or trying to make healthy choices for the future?
I would say all of that.
Okay. Also, I'll start with the healthy choices. So I know a lot of us will make these resolutions and not follow through with them. So I would say the first thing is make it realistic. If we say, we're going to, get up at 5 a.m. and go to the gym every day, I know I'm not going to do it if I told myself I'm going to do that. So I think making realistic goals for yourself and kind of setting an expectation, start low and go slow. So instead of that 5 a.m., I'm going to get up and go to the gym, and say at least once a week. Like if we're not going to the gym regularly and we're wanting to start going to the gym, at least once a week, we're going to do that. And then, write it down. Say, if I've been going to the gym at least once a week for 4 weeks, I'm going to increase it to 2 times a week and go from there, because I think we're all more successful when we can meet a goal. And if we make our goals unreachable, we're going to be discouraged right out of the gate. So that goes with any type of resolution we're making. I just made exercise as an example. But for diet specifically, I know a lot of cleanses, different forms of diets, people will try. And I think depending on what they are, a lot of them, are healthy and, can have some form of weight loss. But I just want to make sure everyone's not trying to replace a lot of their healthy options and, trying to go too quickly. So if we make our small changes as well with our diet, we'll be able to maintain that. So sometimes I think what happens with sometimes certain diets or cleanses, we'll lose the weight, but then we'll go back to our regular eating habits and then we'll kind of gain it back. So I think making those smaller changes, again, setting your small goals and kind of things in moderation, I think end up going a little bit better as far as that goes.
Okay. Another question is, what kind of exercise is safe for students now?
As far as?
They weren't specific, so I would
Okay.
say if you could talk about maybe indoor and outdoor.
I see. Sure. So I'd say indoor and outdoor is currently safe. I would say the outdoor depends on where you're going. So if it's, outdoor bike riding, outdoor jogging, I definitely think outdoor swimming, I definitely think that's safe, but I know a lot of pools have currently been closed, public pools, I'd say. So I know not everyone has access to that. But if, we're talking about different exercise facilities, certain parks, I would be cautious, but if they're outdoors still, I think it's, if everyone is, the facility itself, you yourself are abiding by a lot of the distancing and health hygiene or, hygiene precautions, it would be considered safe.
Okay. When do you think the vaccine will be available for kids below the age of 16?
That is a great question. My hope again would be sometime in the early spring, because they were trying to make the vaccine available to as many people as possible. The clinical trials they did were specifically 16 and up. There are current clinical trials going for under 16. So my hope would be that it would be available for everyone by the early spring.
Okay, and just a couple more questions. What should I do if my child is showing signs of anxiety?
So that is also a great question. I think being able to talk to your child openly about what you're potentially noticing, and some kids may be a little self-conscious about talking about their mental health, but I think the first step is talking to them about maybe what's been bothering them. And then depending on, what they're saying, if you find that, maybe it's something they just need a little bit more reassurance, or if you're a little bit worried about it, you can talk to a healthcare provider about it. So I would say the first step is talking to your kids. And then, you know your kid better than anyone. So depending on how concerned you are about it, I would say then we can involve, potential healthcare individuals.
Yeah, and we also just want to remind parents that we have access to counselors at every school site. It was an investment that our board made in 2015, and that fortunately we've been able to keep even with a challenging budget. So that's always a benefit too. So we will have kids reach out directly to counselors at school sites, but sometimes if parents are concerned, you are welcome to do that as well. And the counselors can actually reach out to kids at school or virtually, as they're doing it at this point too. One more question. Do you recommend keeping masks on at all times when doing outdoor activities?
Again, I think it depends on where the outdoor activity is. So if no one is around you, I think it's safe to take the mask down, but having the mask readily available if you are approaching someone, you feel like you'll be within 6 feet of them, having that mask available to put on. But I would say if, it's a wide open space, only your immediate family members whom you live with, in your household or around you, I think it's safe to take it down.
Okay, and I guess just one final thought. We have 3 days left till winter break starts and we're out for 2 weeks. So do you have any comments or suggestions about winter break or how to prepare maybe coming back in the new year?
I know. Well, I would just want to be safe out there. Try to make the best option for yourself, your family. Just because we are seeing a rise in cases currently, and I just want to make sure everyone's safe out there. Because we'll have a little bit more time. We may be seeing people we aren't necessarily have been seeing, before winter break. So we're all safe and healthy to come into the new year.
Well, thank you very much, Dr. Ramsey, for being here with us tonight. I'm sure we will see you again in the new year. And I just want to, again, thank Hoag and this great partnership we have. This is our second school year with Hoag professionals, and it is greatly appreciated and a wonderful resource for our school district and our community. So thank you very much.
Yeah, of course. Thank you for having me. I'm glad that we were able to, put on a presentation like this.
For sure. And to our families, I just want to say thank you also to you for your continued support and patience with all of us as we get through this school year. Thank you for being here tonight, and we will see you in 2021. Have a good night.